My name is Uzma Shakir. I'm with the Atkinson. I'm an Atkinson Charitable Foundation's Economic Justice Fellow. For me, health equity is a very broad term, but in very simple terms, what it means is that people should be able to access health care irrespective of who they are, what they look like, what their immigration status is, whether they live in, where they live, what their socioeconomic status is, what their color and race is, what their country of origin is, what their cultural preferences are. So to me, health equity is a very broad term. It actually, it focuses more on what I call social determinants of health. But to me, I think health equity must include within it a focus on anti-racism and anti-oppression, because it's not just about being able to access health care in terms of medical care. Health equity is not, health is not about absence of disease. Health is also about, your psychological well-being, your emotional well-being, your ability to function in society in a way that is equitable and just. And that's what social determinants are. So health equity is a broad thing. So it can start with something small, somebody walking in and not being able to access services because nobody understood what they were talking about and they couldn't speak English. But in a broader sense, it's also about having services in institutions, in public health institutions, in hospitals, et cetera, that are accessible physically, emotionally, linguistically, culturally, in terms of cultural preferences, in terms of how people want to be treated. This is over and beyond the sort of medical sort of issue that always comes in health, whether I can, and of course, which is a major thing, if I'm a person of color and I'm poor, and I walk into a hospital, and they don't bother, they can't, and I can't speak English, they don't know how to talk to me, they don't have any language facility, but on top of that, they don't take as much care of me as anybody else. They don't go through the same kind of, tests and, the same kind of process of determining what's wrong with me in a way that they would do if it was somebody else. And I think everything from lack of care to just not feeling like you actually can afford to go to the hospital because you don't, for instance, you're a non-status person, you don't have health care, you don't have OHIP. So your ability to access established health care is non-existent because by definition you cannot access it. I personally think health equity goes way beyond OHIPs. I think health equity, I think it is completely unacceptable, even for non-status people, to be sick and not to be able to go to a health clinic, and for the health clinic not to have a policy which says don't ask, don't tell. I mean, there has to be some mechanism where you deal with people and their health issues, whatever they may be, from a medical crisis to not such a crisis, in a broad way. So to me, health equity is a very broad term, and I think I'm really impressed by the conference here, because I think this is the first time I've actually gone to a conference where there has been a discussion of equity in a broad sense, and people have actually bothered to talk about it in a sort of anti-oppression, anti-racist kind of framework. So I'm very impressed. I think the charter that they have come up with, and which they are developing, which is another good thing, that they didn't just sit down, the board of AOHC didn't just sit down and say we came up with a charter, they're actually developing it online. So you and I have access to it and can give feedback. I think that to me is health equity, to be able to participate in decision making about yourself. I mean, a health charter that is going to determine how all community health centers would function in terms of how they would do their planning, how they would develop their programming, how they would deliver services. And me, as a person of color, as a user, I have an access to it. To me, that's health equity. It's a much broader term. It's about accessibility of all kinds, and not just accessibility as being defined in, physical accessibility or just emotional one. So I hope that answers your question.
Okay, thank you very much. It does.